Pandemics are feared because of the possible disastrous consequences. Diseases like Ebola, Zika, and different forms of flu are infectious and spread easily, but that doesn't mean that they're pandemic. A pandemic is defined as an infectious disease that can easily and quickly spread among people over very large geographic areas. A pandemic, at least in its extreme, hits people across the globe. Pandemics have been known for centuries. The Black Death or bubonic plague that killed 60% of the European population in the 14th century, and the influenza pandemic of 1918 to 1919, known as the Spanish flu, was a global disaster that killed between 20 and 40 million people. Therefore, scientists have been preoccupied with finding a way to prevent the epidemic diseases. Vaccination was invented in 1796 by the English doctor Edward Jenner. He developed the vaccine against smallpox by injecting humans with weakened versions of the smallpox virus. Since Jenner's discovery, many more vaccines have been developed and have become our most effective means of fighting infectious diseases. But all vaccines have side effects. For instance, the HPV vaccine against cervical cancer can cause headaches and nausea, but scientists haven't found any serious side effects. Still, some parents won't let their daughters have an HPV vaccine because they're afraid of serious side effects like cancer and permanent headaches. Rumors about serious side effects spread quickly on, for instance, social media, and is one among many examples of the conflicts between scientists and patients' experiences of vaccines and their side effects. Another question is, how effective is the vaccine? A vaccine against flu is only effective against a small spectrum of possible variations, and the flu virus is mutating very quickly. This means that a general flu vaccination only provides limited protection. Effectiveness is also a question about how many individuals in a population are vaccinated. If someone with measles is surrounded by people who are vaccinated, the disease can't easily be passed on and it'll disappear quickly. This is called herd immunity or community immunity, and it gives protection to vulnerable people such as newborn babies and those who are too sick to be vaccinated. This leads to the question of whether vaccination should be mandatory. Studies by ASET suggest this has limited effects, but still authorities put pressure on people. In a sentence in a criminal court in France, a couple received a 2-month suspended jail sentence for not letting their children have a polio, tetanus and diphtheria vaccination. They didn't mind the polio vaccination, which was the only mandatory vaccination, but it was pooled with tetanus and diphtheria, which they objected to. One group where mandatory vaccinations are in question is health workers, since they are themselves a high-risk group and also in risk of spreading viruses to groups with a weak immune system. But health workers are rarely vaccinated. For instance, in Ireland, only 18% of nurses are vaccinated against flu, despite being a risk group, and this leads to the question whether vaccination against flu should be mandatory for health workers. As we've seen, mandatory vaccinations and other measures taken as a response to pandemics often interfere with people's ability to make individual choices. In some situations, it's convenient to isolate infected people or communities to prevent spreading of an infection. This was the case when Ebola spread in Liberia, Sierra Leone and Guinea in 2014. Ebola has a high mortality rate, and there's no vaccination or cure. It's therefore necessary to track down and isolate patients and people who've been in contact with infected people to stop the outbreak. infected patients are placed in a so-called isolation device, and staff coming into contact with Ebola patients have to wear isolation suits. Soon after the Ebola outbreak, an airline passenger from Liberia introduced the virus into Lagos in Nigeria. This incident caused stricter border controls to stop Ebola from spreading further. Another strategy for fighting infectious diseases is preventing people from gathering in large groups. Authorities can choose to close down concerts or sporting events, but it's not always agreed on when to do so. Across the world, health experts have urged the WHO to put pressure on the Olympic Committee and the Brazilian government to move the 2016 Olympic Games from Brazil.
The Olympics ought to be postponed or moved.
They're worried about the rapid spread of the Zika virus. The WHO disagrees and maintains that there are no public health justifications for moving the Games. In the case of a pandemic emergency, the WHO has made recommendations on how to distribute scarce resources based on the principle of equity. This means practices that are considered fair but not necessarily equal. It might be necessary to prioritize some groups before others. For instance, the WHO recommends giving priority to vaccinating healthcare workers since public healthcare needs to function during a pandemic. The WHO also insists on global justice. Most countries' national plans focus on protecting their own citizens, an approach which favors economically powerful countries. But according to the WHO, technology and resources should be shared with developing countries. Equal access to information is also an issue. Everyone should have access to information from public health authorities, and governments should use a wide range of methods to reach all citizens. In the case that countries face a scarcity of resources in a pandemic emergency, how should governments then prioritize? Who should be prioritized? Pregnant women, the elderly, children, healthcare workers, or government officials?